Thanks for joining us, everybody. We're at the new St. Paul's site in Vancouver, doing a tour of this amazing building and trying hard to blend in with my brand new steel-toe boots with the almost 2,000 workers who are on this site, putting the final touches on this amazing building. It's amazing the progress has been made. It's been about 2 years since I was last here, and the difference is night and day. This building is going to be handed over to Providence Healthcare ideally in the summer, and then we'll begin the process of commissioning this brand new hospital. This is a regional center for the province. It has special features where the mechanical rooms are above tsunami and flood levels, so it can run for 72 hours on its own in the event of a large earthquake or other traumatic event. This building will continue to run for that critical 3-day period following a major disaster. In addition, it's a regional transplant center where highly technical transplants are undertaken. There is a special NICU maternity service that will be here to support families with complicated births to make sure that the brand new babies are supported. And of course, it will be a hub of service for the region generally around emergency and urgent health care. I'm really excited about the work that's been happening here. The building is absolutely beautiful. It will be a place of healing, using the best and latest technologies to facilitate fast healing for people and to minimize the movement of patients so that care teams move around them instead of patients having to move, which minimizes risks of infection and complications. I don't know if you can see it, but behind me, coming up out of the ground, is another critical feature of this campus of care, which is a research building. This building will house Providence Healthcare's research team, as well as other specialized physician care offices. And it is part of our strategy to support our life sciences sector, which is the fastest growing life sciences sector in the country, anchored by major companies like Stem Cell that have been working here for a long time, and Accelera that was instrumental in the COVID response. And those companies, along with so many others, are creating jobs and opportunity here in the province and in the Lower Mainland in ways that are remarkable. As other jurisdictions turn away from science, British Columbia is doubling down and making sure that we are able to seize the opportunities that others are leaving on the table to grow our economy, create jobs and opportunity. Healthcare isn't just care anymore. It's also research and development in ways that help grow our economy. And that's what's happening on the St. Paul site. I want to thank Fiona, the CEO of Providence Healthcare, her team, PCL Construction, that have done an amazing job on this building. The almost 10,000 tradespeople who will have been through this building at one point or another, doing incredible work for the people of British Columbia. It is remarkable what you have accomplished here, turning a brownfield, old railway site full of, that used to have this oil dumped and old concrete, turning that brownfield site into a world-leading healthcare site and research site. It's amazing what you've done, and I can't wait for this facility to go. So thanks very much for joining us, and I hope you never need the services here, but if you do, know that they'll be the best in the world.
Hi, Premier. Good morning. I wanted to ask you about the staffing shortages that, of course, we are seeing across the healthcare system. I mean, what steps are being taken to ensure that this hospital can open, staff can operate at its planned capacity?
Our Health Human Resources strategy was a response to the very real challenges that we face not just here in British Columbia, but across the country in terms of making sure we have the doctors and nurses to be able to deliver the care that people need. There is a significant improvement in this site with efficiencies of using automatic systems for supporting doctors and nurses to reduce demands while they're working, reduce stress, and facilitate a comfortable working environment so they can focus on patients getting better faster. New facilities like this are huge attractors for recruiting new doctors and nurses, supporting our efforts to recruit doctors and nurses in the U.S. and other jurisdictions who can come and work in a world-leading hospital right across the street from a major research institution in the hub of the nation's fastest-growing life sciences sector. That is all part of our recruitment pitch. But of course, also in September, we have our brand new medical school opening in Surrey, the SFU campus of the medical school. We've increased spaces at UBC, and we are turning the corner on this. We were the most improved province in terms of connecting people to family doctors. Now, in the latest study, 82% of British Columbians have access to a family doctor, up from 71% just a couple of years ago. We've recruited and hired almost 5,000 new nurses over the last 3 years. That work will continue, and we are meeting minimum patient-nurse ratios in a number of sites across the province, and we're committed to do that across the province in every site. Our big challenge remains rural health care, and so making sure that we have those doctors and nurses in smaller centers continues to be a challenge. We're doing a review of our incentive structure to make sure that we can recruit and retain those doctors in smaller centers across the province. It's important work that we're doing. We're doing a partnership with health authorities like Province and with the academic training centers like UBC and SFU, as well as through recruiting doctors and nurses from other places around the world.
Just on that note, you mentioned rural communities. A big concern right now is the emergency department wait times, ER closures, that sort of thing that we're seeing specifically in more rural communities. How will this hospital help to address that issue, and how quickly can patients start to see these changes being made once the hospital opens?
Well, this hospital will be a regional center for things like transplants and other intensive chronic disease management. People will depend on the services here both virtually, through virtual care, but also through attending the site, which is why we've also supported an increase in housing for families that have to travel in order to access care from other parts of the province. The crucial training work that's going to happen here with resident doctors and with training nurses will support our effort to get more doctors and nurses out into the province across every corner of British Columbia, making sure that that care is available. We are turning the corner on emergency room closures. We have fewer this year than last year. Our goal is obviously 0 closures. It's incredibly challenging when there's just a couple of doctors and say 4 nurses in a very small community. If someone gets sick or has a family emergency, it can close an emergency room. So that's our big challenge, is having that resilience in place, the additional staff to make sure that doesn't happen. That's what we're working on hard to deliver for British Columbians.
Next one is Michelle from Hawaii.
So St. Paul's has a pretty successful overdose prevention site. I'm just curious how this new site is going to be addressing patients with insurance and their...
Thanks. St. Paul's, Dr. Nolan and her team have pioneered and driven something called the Road to Recovery. This is an integration of addiction services across our healthcare system, ensuring that there's no wrong door for patients that are seeking addiction recovery, and that there's seamless transition. If they show up with an overdose in emergency, they can go directly into a recovery program. The work that's happening at St. Paul's is remarkable and innovative, and it echoes actually what St. Paul's and Providence did in response to the HIV crisis many years ago. The leadership that's being shown here will continue in the new site, be expanded, and will have obviously significantly better resources available to support patients that are struggling with addiction in different ways. It will also have improved facilities for mental health services, including mental health services for people that have both addiction, mental health issues, and serious brain injury. Dr. Vigo is working closely with Providence as well as with other health authorities. He's our special advisor in this area, an expert in psychiatry and treatment in response to this particular population, to ensure that we have the care that we need across the province for this very vulnerable population that is at a very high risk of overdose, but also too often is in and out of our jail system. We can do better in terms of care and public safety and outcomes for people who are struggling with this.
Okay, Okay, so I didn't hear mention of the new overdose prevention site being opened here, but my second question is, what population is this site being built for? And like what year would you say BC is estimated to meet that population?
So this site will have more than 100 additional patient beds on it. The hospital is expected, because of infection control measures that are not available at the current site, because each room will be a single patient, and because of some of the technological HVAC and other systems that are here, there will be reduced complications, increased throughput of patients. They'll be able to move patients through faster than they do at the current St. Paul's site. So while there is the additional beds at this site, our expectation is that with the technology that's on site, patients will be treated and out the door faster than they would in the old site. The population growth that's taking place in Vancouver is significant. Where we're seeing major population growth though is up the valley and in Surrey, which is why we have a brand new hospital that's opening in Surrey as well. Why we're adding additional capacity of phase 1 of the current hospital soon, an additional patient care town there, as well as a significant expansion in Westminster, to make sure that we're able to address the needs of people further up the Fraser Valley as well. In fact, across the province, we have 17 hospitals with major expansions of brand new builds. This is partly what is driving some of the additional expenditure the province is having to undertake in order to meet the needs of our growing and aging population. We have to ensure that people have these services, that the healthcare is there for people when they need it, and we are doing that work across the province to ensure that happens.
Excellent chat from the team here.
Thank you, Premier. On a separate topic, you mentioned that you will be meeting Mr. Altman with OpenAI. I was wondering, when do you plan to have that meeting, and what do you plan to say to Mr. Altman?
Thanks. Yeah, we don't have a date yet for the meeting with Mr. Altman. I'm certainly looking forward to having that conversation. The core message, I think, is the message of families and the parents of the kids who are living in Tumbler Ridge. The full comfort that they take from the changes in policy at OpenAI, and the fact that this should have been brought to the attention of authorities before this happened, and that this incident could, this tragic and horrific tragedy could have been prevented. I want to recognize that they did come forward, they did bring information forward to police, they didn't try to cover it up after the fact, but this was a colossal, horrific mistake, I guess is the most generous interpretation I can offer, to fail to bring that information forward to authorities. And it's important that Mr. Altman realizes that, and I will be looking for his support for a national standard across Canada, a national threshold where all AI companies must report, and clear consequences for if they fail to report incidents where people are planning violence, planning to hurt other people, and using these tools to develop those plans.
Thank you, Premier. As a follow-up, you mentioned the need for a national level kind of a check on the industry, because you can't rely on the industry to check itself. Is there anything the province can do on its own front to hit this matter? I know it's a federal jurisdiction, but are there anything that you can do in the meantime, from provincial side, to address part of this issue?
Yeah, absolutely. There are pieces that the province can support the federal government on in terms of safety of our kids around social media, as well as in relation to establishing a threshold for reporting for AI. We've reached out to the federal government and the minister responsible to offer our assistance as they develop these standards. We have lots to share from our experience with social media companies and suggestions about best approaches to keep kids safe, but also to ensure that there's no competitive advantage for one company having a lower standard than another company in terms of reporting when someone is planning a violent attack. We need all companies to be on a level playing field when it comes to AI in terms of reporting standards, what's expected, and what the consequences are for not reporting.
Question?
Are you worried the minister leading the AI power in conflicts because he's also trying to tax AI investment in Canada?
Yeah, I think we're all a little bit conflicted about AI. Personally, I use it regularly. I find it super helpful for repairs around the house. I fixed a running toilet in our family's house without having to call a plumber, thanks to Claude from Anthropic. I'm super grateful to Claude for the assist. I'm not a handy guy like that. And so there are lots of benefits that come from AI. I think many people have seen that and experienced it. There are many challenges that we're going to have to address with AI. There are concerns about employment, displacement of jobs. What is that going to mean? Certainly in Tumbler Ridge, we saw a terrific example, potentially of an AI assisting someone in being more lethal and more effective in carrying out an attack against British Columbians. We don't know yet, we haven't seen the transcript, but the total failure of the system to flag that to authorities and prevent it from happening, we have to deal with those issues. It is a complicated issue, and I don't pretend that it's all good or all bad, it's both. And so finding that path for British Columbians that makes sense in partnership with the federal government to ensure a national standard is part of how we respond to this. It's an evolving file. There are opportunities for investment in British Columbia that are very positive. There are impacts that AI has already had on BC that are devastating. And so we have to find that path forward for the people of our province.
Thanks, everyone. We're going to carry on with the tour now.
Thanks, everyone.